Hi, I'm Bill Logan. Welcome to Physician News Network. There's helpful news if you're one of the millions of Americans suffering from chronic back pain. The FDA has cleared a procedure that has many patients saying goodbye to back pain without drugs, needles, or surgery. In our feature story, we'll be introducing a medical breakthrough. It's called non-surgical spinal decompression. With us during this program, we've invited an authority on the topic, Dr. Frank Liberty, founder of Spinal Aid Centers of America. Have you had multiple opinions for a back problem and are still living in pain? You sometimes feel when it comes to your chronic back pain, you don't know where to turn or who to trust. Find out who's a candidate for this procedure and more. Stay tuned. Physician News Network is next. Program, we will be discussing non-surgical spinal decompression, a relatively new procedure that's given hope to many who have tried just about everything else to relieve their back pain to no avail. For those who have been told their disc is degenerated, bulging, or herniated, or if you have sciatica or stenosis, you're no stranger to pain and have a serious problem. When it comes to your spine and the delicate tissues, including the disc and nerves, it's extremely important to carefully select a highly trained healthcare provider and one who can offer you the option of a non-invasive treatment. Up to now, patients have had to select from corticosteroid injections, selective nerve blocks, epidurals, muscle relaxers, painkillers, extended bed rests, lengthy alternative therapies, and risky invasive procedures, or worse yet, surgery. But it seems now for many, science may have cracked the back pain code. Spinal Aid Centers provide non-surgical spinal decompression treatment and are spreading nationwide. We're fortunate to have the founder here with us today. Welcome, Dr. Liberty. It's a pleasure to have you here with us.
Thank you, Bill. It's a pleasure to be here.
Now, I've heard a lot about this procedure, this back pain treatment that's called spinal decompression. Exactly what do you mean with this?
Well, Bill, there is a surgical procedure known as decompression, so we want to preface this by saying it's non-surgical, and that's one of the features and the benefits of the program. And you know, I'm just going to use a word picture to help you understand this a little bit better. First, I want you to imagine that this involves the discs that are bulging or are actually herniated, where the material is actually spilled outside of the disc content, and or degenerated discs. Now, if you think about an airplane, inside the cabin we positively pressurize the cabin, and outside is negative pressure. Now, if you crack the window, everyone knows all the contents will go from positive to negative. Everything flies out the window. In non-surgical spinal decompression, what we're attempting to do is to create that same negative pressure within the disc. It's called intradiscal negative pressure. When we create a negative pressure inside the disc, we draw back in contents that have bulged, protruded, spilled out, and you're also drawing back fluid from surrounding tissues. So basically, you're actually increasing the disc height. It handles a myriad of the problems that you spoke of. If the disc is degenerated, the fluid will be drawn in, heightening the disc, and the disc height increases. So you handle deterioration, degeneration.
And this has just been an incredible find for the medical community to be able to do this sort of thing to help people without having to go in and do surgery or give a lot of drugs.
Bill, it truly is a medical breakthrough. People have suffered back pain forever and ever, but right now in our country it's literally at endemic or pandemic stages. When you can come up with something that's 1/10 the cost of a surgical procedure, but uses no needles and no drugs and no surgery and has a high success rate. In fact, I don't even want to go into the numbers that they claim of the relief or the success it's bringing, because it almost seems unbelievable. I can tell you, though, that the outcomes are very impressive. Most patients are well or better.
Who would be the primary candidate for this sort of procedure?
Bill, right now there are 65 million people with chronic back pain. It's estimated that when the baby boomers reach their prime, which right now they're turning 61, so within another year or so, it's estimated that there'll be 77 million Americans with chronic back pain. At any given time, only perhaps 10 million will be helped. The candidates, though, are certainly people who have chronic pain and haven't had a resolve. These people have tried other therapies. They've had x-rays, they've had MRIs, and they've usually had a diagnosis.
And figured, I've just got to live with this.
Many people feel they've got to live with it. Many have tried everything and it didn't work. People basically want to be out of pain, but today they want their lives back as well. We look for people who have previous diagnoses: disc bulge, disc hernia, true sciatica, stenosis, which is a narrowing of the space where the nerve exits, or severe degeneration. For certain, these patients are candidates. There are a few patients that feel the results immediately, and they describe it as like a runner's high. It's when endorphins kick in. Others within a few days, some halfway through, and for some, the very last session. Another thing that determines this is how a person's tissues and muscles are going to react to this. Some people have more tensile strength than others. Some people have weaker muscles than others, and all these things are a factor combined. Bill, we monitor our patients very closely when they're on this procedure because there's some people with complications. There's osteopenia, there's geriatric situations, there's situations where there's antalgia. Discs can herniate and the material can bulge in different directions. Those that have central hernias are more difficult. The more stenosis there is, or the more severe the degeneration. Some people come in with toe drop, some foot drop, some leg drop. So there's different severities, and people who have suffered for longer periods of time. So, we know which cases are going to respond quicker and more favorably. But overall, the response rate in this has been just a breakthrough in any scientific terms.
My quality of life was horrible. Day-to-day pain was just almost unbearable. I'm in construction and my back is, almost 95% of my job. I hurt my back at work. I could not walk. I was injured that bad. I had degenerative disc disease and 2 herniated discs. One was bulging. I didn't know where to turn. I was so upset. I pretty much had a meltdown at that point. The first treatment that I had, it was just absolute instant relief. I never felt anything like it before. After the 6th and 7th treatments, my quality of life had already started taking a turn for the better. I asked the doctor if I could try playing golf. I went through 18 holes of golf without one back pain problem. I had never experienced that in almost 7 years. I was able to play with my kids, run around. I was able to run. I'm getting up in the mornings now and I have no pain. And I'm also going to bed at night with no pain. I'm 30 now. I feel like I have the back when I was 20. When I was doing all my sports and having an active lifestyle. I feel like my back is completely healed. I would strongly recommend spinal decompression to anybody that has back problems like I've experienced.
And welcome back to Physician News Network. I'm Bill Logan. With us today, Dr. Frank Liberti, and our topic, non-surgical spinal decompression, getting rid of pain, getting your life back. In a lot of ways, this sounds similar to what they used to refer to as traction. Is it the same thing, or are we talking about apples and oranges?
We are talking about apples and oranges. In fact, when I first went into practice in the late 70s, I relied heavily on traction. In traction, Bill, we would use excessive weight. I would think nothing of using 100 pounds, 140, 160, 180. In fact, I'd turn the machine up as high as it could go to try to get relief. And we had some relief, but again, those were the patients who had musculoskeletal problems. And so traction, Bill, it almost went away. You don't see it in the hospital anymore. The key to this whole thing is this: when you go to stretch or pull somebody apart, they're going to resist, the body will resist. So there's a muscle called the strut muscle, and there are cells called spindle cells. and they monitor tension on your muscles. These decompression machines find a way to overcome the strut muscles and spindle cells to the degree where they relax. And then they let us go and pull to the degree now where we're not tractioning anymore. We're actually reversing pressure. We're creating a negative intradiscal pressure, which traction didn't seem to be able to get to. It never overcame the strut muscles and spindle cells like these expensive devices are able to do. And that's the whole key. Part of the wonder of this is that this actually stimulates the body to actually produce new cells. They're called collagen cells. Now, not only will you rehydrate the area, produce new cells, which helps in deterioration, but those cells, if I might, they're like sticky cells. They're like glue. You ever heard when you fracture a bone, it heals twice as strong? Mm-hmm. Well, if you've got a disc and the outer bands have ruptured and your disc is herniated and those fibers are torn, with a negative pressure, we draw the fibers back in, and now the new tissues, the collagen fibers, stick to those fibers and scar them together, glue them together. That's how the body heals itself. The decompression enables the body to go through that process. The actual cost of decompression is significantly less. In fact, it's less than or equal to the deductible of some of the other invasive procedures, especially the surgical procedures. However, we recognize that a large percentage of our patients are actually on fixed incomes or Medicare patients. And certainly we didn't want that to be a problem for anyone. So I can truly tell you I'm very comfortable now in telling you that I believe everyone can afford the procedure. One of the reasons is we've developed flexible payment plans. And another is we actually have banks that provide patient financing. Now, this is a brand new concept in patient care to augment patients who may not have good insurance or whose insurance won't cover it. And those finance plan bills can extend out for basically as long as a patient needs, making monthly payments so low that even Medicare patients on fixed incomes are truly able to afford the procedure. And that's a commitment that our spinal aid physicians have made in recognizing that people need the relief, but they are on fixed income.
And the need for the relief, it's sort of like, I'll do anything to make this pain go away. And if folks have tried everything and not come up with any procedure or any sort of cure, this is something that definitely would be right in their ballpark to give it a shot.
Bill, I see a lot of patients who have tried other things, taken the time, spent the money. They're not so upset about that. They're upset that they did all that and they're still in pain. Mm-hmm. People will or can learn to live in pain, but when it affects the quality of your life, patients who have to sleep in chairs and can't sleep in with their spouses, there's people who can't lift their grandchildren, engage in their sports or recreations, or home chores or tasks. Patients of ours haven't been able to feed themselves, dress themselves, certainly those patients.
And not to mention the folks that walk around in a cloud because of pain medication that just, keeps them sort of loopy all the time. This does it without having that sort of side effect.
People they develop addictive behaviors to these drugs. It becomes chronic use, and no one wants to see that. There isn't a physician around that wants to see that happen to a patient.
All right, Dr. Liberti, thank you very much. We're going to take a quick break right now, but when we get back, we'll be talking with actual spinal aid decompression patients. Their stories are pretty amazing. Stay tuned. We've had the opportunity to discuss this treatment with various decompression patients who have had amazing results. Here's what they had to say.
My back pain started shortly after I had my third child. It just started by doing something simple, by lifting up a laundry basket, and I pulled my back out. And then it started doing this in a series. Like this would happen, and 6 months later it'd go out again, like if I sneezed. Or it's usually stuff around the house. I was an active runner. I participated in, half marathons and working out at least 5-6 days a week, and it started really bothering me. I couldn't sleep at night. I was on Valium. I was on a bunch of different, I don't even know all the names of the medicines that my doctor put me on. I couldn't run. I couldn't even walk. I couldn't It was just constant chronic pain, just where you're just like, oh man, is this it? You know, is this the way the rest of my life's going to be? I had 3 herniated discs and 2 bulging discs in my L1 through 5. So every one, if one wasn't acting up, then the next day another one would be. So between L1 through 5, they were all pretty messed up. So when I got on the machine, it just felt really, really good. I mean, it was almost like a soothing sensation on my back. It felt like my ligaments that were so jammed tight were just being spread apart. And it was good. I mean, the first treatment, I had relief, but then it was probably about after the 7th treatment that I thought, wow, I think this is gonna work. It's definitely given me part of my life back. I'm definitely happier now. And Tuesday, I ran and walked 9 miles. Wednesday, I did the treadmill for an hour and then did the elliptical. Then yesterday, I did an hour of lifting weights, core for my back, and then I was on the bicycle. So to me, I'm right back where I was, which is a miracle to me. I would definitely recommend spinal decompression. I think anybody that does not want to go the route of having surgery and the downtime, I think that they should definitely try this first and see if it'll work for them. I feel perfect, and I'm not taking any ibuprofen, I'm not taking anything anymore. I feel like I'm back to normal.
Before the therapy, my life was really marked by constant pain. It affected every area of my life. It affected the way I worked. I work at a computer. It affected me sitting down. It affected me standing up. It affected me when I exercised. It affected just about every area of my life, including my sleeping. And it had basically taken over my life, and I was in constant pain. I had been to many doctors, and the doctors had told me that I had, not only did I have a herniated disc, but I also had degenerative disc disease. I also had a little bit of spinal stenosis and arthritis. So I basically had everything, and pain was a constant in my life because of that. And they said surgery really wasn't an option because a couple of things. They couldn't pinpoint the spot, and also just the fact that they didn't think it would help. I first heard about the treatment from an ad I saw in the paper, and I read it and it said breakthrough technology has been created, and when I first heard it I said, well, here we go again, just another false advertising. I really didn't take it seriously. I had a friend that talked about it, but he also was thinking about it, but he also thought it was false, so I pretty much ignored it. But the more I read about it, it sounded interesting. I've tried everything else. I've tried medicine, I've tried physical therapy, I've tried nutritional changes. I said, what do I have to lose, basically? From the beginning to the end, the experience for me was basically a simple procedure where I laid on the table, I was strapped in, and the machine began some gentle pulling. And I noticed the pulling, but I also just relaxed and allowed the machine to do what the machine does. And for me, I looked forward to those sessions on the table. It became a non-threatening, very simple procedure. I felt a difference from session 1, but I wouldn't say that was total relief, but I felt, I would say from about the 3rd session on, I found a remarkable relief in the pain in my legs, and it just progressed. It progressively got better until I'm still experiencing a remarkable relief of pain in my back. I would highly recommend spinal decompression therapy to anyone who's really suffering from back pain, any of the major back disorders. I think it could really help improve the quality of your life.
And welcome back. Weren't those some great stories? It's amazing to know there's a group of dedicated providers who share the common purpose of bringing you non-surgical spinal decompression. Patients come to these doctors for the relief of pain and to get their lives back, and that's just what they give them. We hope our program has been both informative and educational.